Dr. Cori Takesue's journey with the National Health Service Corps, or NHSC, is a story of dedication, perseverance, and impactful change. It all began with a valuable piece of advice from her executive director at the time, Dr. Diana Shaw.
I learned about the loan forgiveness program from our executive director at the time, Dr. Diana Shaw. She was really good about keeping all of her providers informed about the different types of loan repayment programs or loan forgiveness programs, because she knew that coming to a rural area, you weren't going to necessarily get the competitive salaries that you might in more urban areas. And she also knew that paired with the cost of living here would be a lot for a provider to want to stay. And so she was always invested in trying to find ways to help providers bring their loan costs down so that they could stay on the island and feel comfortable in their living, but also kind of continue to bring services to the organization. So even till this day, she still sends me things, knowing that I probably haven't fully paid off all my loans yet. She's still continuously sending stuff.
Deciding on the length of commitment to the NHSC program was a significant decision for Dr. Takesue. With options ranging from 2 to 6 years, she carefully considered her future and the potential impact of working in a geographically isolated area. Ultimately, she chose a 3-year commitment, balancing her career goals with the realities of rural practice.
It wasn't too difficult. I think that the only challenge that I came across was I had consolidated my loans at one point, and tracking down the original promissory note was probably the most difficult. I think some of the big concerns were, making a commitment. The program is either 2-year, 3-year. There was one that was a 6-year program, and really giving thought to what kind of time commitment do I want to give.
One of the major challenges Dr. Takesue faced was the limited resources on the island compared to larger areas. Now, despite these constraints, she found her work deeply rewarding. The appreciation from the community and the tangible impact of her services made her 10-year tenure with the organization that much more fulfilling.
And a lot of time pressures, constraints on a person, and really having to consider those factors, whether or not you're going to commit to kind of a long period of time to this shortage designation area. So I think that kind of weighed heavily in the decision making, where I ended up taking the 3-year and not the 6-year, just because I wasn't sure the direction the organization was going. The biggest challenge is something just the overall island experiences, which is access to care and community partnerships on island not being equivalent to kind of the larger areas. For example, Maui, we're part of Maui County. We don't have the same resources that that the island of Maui has. We actually are much more limited here on island, which kind of makes it more difficult to provide patients the overall best treatment when you don't have the things that they need outside. And so I think that was the biggest challenge with working in a kind of a rural area is seeing that you're going to have to work with some limitations.
Dr. Cori Takesue's commitment to the rural healthcare truly came to the forefront when she became one of the proud recipients of the NHSC loan repayment program.
I was actually working at the site prior to receiving the award. So for me, I had already kind of gotten used to living in the area. Luckily, I'm someone who doesn't mind the outdoors and kind of not having access to things. And so for me, living simply was something I learned over the years. And so it was an easier adjustment because I had already done that. But I think that in terms of the work that we do here, I think it's very rewarding because when you're in a place where there's a shortage and there's limited access to things, you can really feel how appreciative people are for the services that you do provide and the work that you're capable with them, because there are limitations, and just seeing the changes that you are helping to make is is rewarding, and so that makes you want to stay. And it's part of the reason why I've stayed at this organization for 10 years.
Her participation in the NHSC program stands as a testament to her dedication and resilience. It's a story of turning challenges into opportunities and of making a lasting difference in the lives of her patients and the broader community.
I think the best story or lesson learned from participating in the NHSC program is just the amount of peace of mind that I got. Being able to receive the loan repayment option was truly helpful because I was able to, once I got approved, I was able to get the money relatively quickly, and I was able to pay down the highest interest loans that I had taken out, and just getting those high interest loans out of the way really kind of gave me more peace of mind that I was going to be able to then fulfill the rest of it. It just, when you have kind of that debt on your shoulders, it's really a lot to hold on to, and it was worth it for the schooling, but it's a lot to hold on to. And so knowing that I could swipe some of that away relatively quickly, even though I had to commit to working and all of that, that was nothing compared to just having that debt swept away from me. So peace of mind is really truly what I got from this program.
Dr. Cori Takesue's inspiring journey with the National Health Service Corps is a powerful example of how dedication to service and community can lead to both personal and professional fulfillment.